For Mind Matters on Rev-Up St. Lucia, because at Rev-Up 95.9 FM, your mind matters.
Mind Matters with Dr. Julius Gilead, brought to you the compliments of Forsyth.
Mental health is the foundation of our well-being, yet too often it's overlooked. At Forsyth Mental Health Solutions, our team, led by a licensed psychiatrist, provides personalized assessments and treatments for depression, anxiety, psychosis, dementia, and more, bringing expertise, compassion, and solutions that make a real difference. We also provide forensic psychiatry assessments, mental capacity evaluations, and workplace training and seminars, giving organizations the tools to support employee mental wellness. For more information or to schedule a consultation, visit us at the Top-Ear Hospital, New Wing, Castries. Call 459-2234, send a WhatsApp message to 584-9498, or email us at forsych.mhs@gmail.com. That's forepsych.mhs@gmail.com. Our professional staff will be more than willing to assist you. Visit Forsyth Mental Health Solution and let us build a future where mental health is prioritized. Because when minds thrive, so do people.
It's now time for Mind Matters with Dr. Julius Gilead. Dr. Gilead, very good morning to you. Welcome once again to Rev-Up.
Good morning, Andre, and good morning, listeners, both locally and abroad. I am Dr. Julius Gilead, psychiatrist, and welcome to Mind Matters. Today, we're exploring a very powerful idea in modern psychology, and that is the science of safety and connection. And when we think of safety and connection, we think of all our relationships, in fact, our whole well-being. Because when you feel safe, you breathe easier, your voice softens, your shoulders drop, you feel relaxed, and you feel like yourself again. And when safety disappears, what happens is that we, even for a little moment, the body knows that it disappears even before the mind does. And I'm sure you can think of any situation. You're walking down the road and you hear a car's brakes screech, and one time your whole body tenses before your mind even is aware of what is happening. Or you may be speaking to somebody and their voice raises and you feel something inside of you even before your mind tells you what's happening. So safety is something that's important. And in psychiatry, I see a lot of focus now on that aspect of mental health. There's been a lot of research done since the 70s on something called the vagus nerve. So that's a big nerve that goes from the brain down the back of the neck, and it innervates right below the diaphragm. So it's a big nerve that passes below the diaphragm, and it innervates all the organs of the abdomen, the pelvis, part of the lungs, and that is the nerve that is responsible for us feeling safe. Now, that nerve is divided into three parts. Well, you could say that's the three main parts of it. There are other parts, but they don't have as important a role as the role in safety and connection. So the front part of it is called the ventral vagus system. And when that part of that nerve is active, we appear calm, we are more open and social, and we basically feel safe. When we sense a threat or danger, another part of it comes online, and that's the sympathetic nervous system. And what that does, it pushes us into fight or flight. Now, persons believe it's just fight or flight that happens, but there are other things that happen as well. So there may be fight or flight, so your body prepares to fight away the threat or the danger, or your body prepares to run away from the danger so that the system can feel safe. But other things can happen. The body can freeze. So if the freeze response happens, then the threat realizes that this person or this organism is not taking me on, so it may go. So that's an attempt to get the threat to move away from you. Or the fawn response. So fawn response is us giving up to what the threat is demanding of us. And the last one is what we call the fester response. So as a result of fawning, a lot of persons develop resentment towards what the perceived threat. And if you look at that in the light of relationships, it's very important. And we're going to look at that a little later. Now, the sympathetic nervous system uses up a lot of energy from the system, because just to prepare us to do those 5 things that I mentioned, energy has to be used up. And with the sympathetic nervous system, there's a lot of mobilization. So either mobilization of mental resources or physical resources. And unbelievable to many people, but the brain actually uses more energy than the rest of the body. Yeah? So what happens is that eventually, if the threat does not go away, the energy resources become depleted and the body becomes immobilized, or the system becomes immobilized rather. And that may appear as disconnection. So the body basically shuts down, or in some people it goes numb. So there may be fainting may occur, or the person may pass out, the person may dissociate, the person may may go to the extreme of even becoming psychotic. So when somebody becomes psychotic, they actually lose touch with reality. So the aim of the dorsal vagus is basically to remove the person from the active presence of the threat. And I guess, again, to allow the organism to get a moment of relief from what's happening. Now, the difficulty with that system is that in the presence of a threat, if the threat does not go away, then something else happens, and that's chronic stress. So the sympathetic nervous system is the part of the nervous system that has to do with stress. So basically, if the threat is not, if the person is not relieved from the stressor or the threat, then that person goes into a moment of chronic stress, or period of chronic stress, and that is not beneficial to the system. Now,
would you agree? A lot of us live just like that.
Yes, and it's something we're going to get into. So you see, a lot of people have the mistaken idea that trauma is just something horribly bad that has happened to you. And actually, what science is not showing is that there may be something called big T traumas and small T traumas. Now, the big T traumas are like, the hurricane that hit, Melissa just hit Jamaica, and it's a huge thing that devastating and so on. So when that happens, then in an acute state, the body uses up all the energy and disconnects, and that's where a lot of PTSD symptoms may come from. So something big happens to the person, like a car accident, or they go to war, or rape, or something like that, and the person is traumatized acutely, and that may go on for a few months.
Excuse me, what is PTSD?
Post-traumatic stress disorder. Yeah. Now, with the small T traumas is like the rain. So there's no storm, but constant rain. And eventually the area becomes flooded, and that in itself can cause dangers. I'm sure you remember that tropical storm from the 90s, what's the name, that flooded the entire St. Lucia and caused so much devastation.
The trough?
Right. Yeah, so the rain is like the small T trauma. So you have lots of little things happening that we may not even notice as trauma. Yeah. For example, a child or a man in a relationship, or a woman in a relationship, and their partner continues to speak down to them and speak harshly to them, ignore their needs, and so on. That is not seen as a big trauma, but it's the small T traumas that eventually brings the person to a fawn response. So the person may just give up and just give in to what the person is, or it may build resentment, which may eventually cause a blowout at the end. You understand? So we have to be very cognizant of both of these kinds of trauma when we're dealing with persons who are experiencing mental health issues. And that's why that vagus nerve is very important, because persons are not aware that these things are happening. So persons feel stuff and they're not sure what's happening. Now, the issue with that is...
Sorry, just to ensure we understand what you're saying. There may be a quote-unquote little thing or little things going on, right, which is creating some kind of stress in an individual's life. And that individual now may not see it as being something that would create a problem. And at some point in time, as you said a while ago, you used verbal abuse or whatever, you said the person may just explode. That's over a period of time.
Yes.
So what does that explosion look like?
Well, the explosion may look like lashing out, or may look like them pulling away from the relationship, or them engaging in behaviors that are destructive to themselves.
So the behaviors would be some sort of coping mechanism?
Yes, definitely. Another thing to keep in mind is that your body remembers trauma. So a lot of persons may have gone through childhood, especially childhood adverse experiences, that they don't remember, they don't recall it, but the nervous system remembers. So that's where the trauma takes place, at the level of the nervous system.
Can you give an example, please?
An example is a child who grew up in maybe an abusive household. So maybe the child, maybe at the age of 2 or 3, was severely abused, but the child has no memory of that. But then every time the child grows up, every time somebody shouts, also the child hears a shout, the whole system contracts. The person feels a lot of fear and anxiety around persons shouting or around loud noises, and
they have no idea as to why they're responding like that.
Yes, but it's the nervous system that remembers that when there was a loud noise or shouting, that there was pain. So the nervous system is preparing the body to defend itself against whatever it perceives may happen next. And that's why trauma is, or the study of trauma is very important, because a lot of reactions we're seeing in the public today, the persons are not aware that they're not reacting to the thing in front of them, but it's basically their nervous system that is sending signals to their brain to let them know there is danger. And this situation seems very similar to something that happened a long time ago, and you need to defend yourself against it. Yeah?
That's very interesting, Dr. Gilead. I was just thinking about what you said there, and something happens in a person's life, and it's registered somewhere, right? That's what you're saying. It's somewhere it's registered, but you may just ignore it, that kind of thing. But it's there. So since we live in a world that where you get more bad things happening to people, that means everybody is hurting them. Everybody has something they're walking around.
I've been saying that for a long time, Andre. And I mean, when I'm walking through castries or seeing persons with their angry outbursts and so on, I mean, I'm a mental health professional, so I can recognize that person is really somebody who's going through a lot of pain, who doesn't have a clue what's happening with them. And I like to use that phrase, that person doesn't have a clue. The person just knows that this thing is happening, and I'm feeling very threatened by it, and I feel a need to react by defending myself in some way. Yeah? Now, the other end of the spectrum of that is that persons who do go through that chronic stress episode or period, what happens is that because the sympathetic nervous system deals with so many other parts of the body, deals with the immune system especially, it deals with fat storage and glucose and metabolism. It deals with muscle contraction. It deals with so many other parts, your organs and so on, how they work, the intestines, so the GI system, the gastrointestinal system. What happens is that with chronic stress, all of those systems start to break down. And what is being found now is that a lot of even things like cancers are can be due to chronic stress. Things like autoimmune diseases, because you develop an autoimmune disease and you go to a doctor and they tell you the cause cannot be found. And a lot of the time the cause is due to somebody who is, and there's a famous quote that Gabor Mate uses. He says that persons who love to say yes when they really want to say no, those persons tend to be more prone to autoimmune diseases. Yeah. So just saying yes all the time, does not benefit your system, because it puts your system into fight or flight, and then you develop a fester response with resentment and so on. And once your system is in that fight or flight mode, which is what we call a survival mode basically, then you're consistently churning out something called cortisol, which is a stress hormone, which affects so many parts of the physical body and can lead to other illnesses later on in life. So it's very important to learn how to recognize safety and how to cultivate safety. Yeah, I see you look a bit confused.
No, I'm not confused. I'm just thinking about all these experiences that you're talking about, and again, since we're living in a world that is not perfect, right? How can someone limit those things, especially as a child?
Yeah, so it's not something that a child can limit, but the parents, yes. And I mean, it's me again calling for improved mental health services across the Caribbean, because our mental health services in the, especially the small island states, are paltry in my opinion. For somebody to get quality mental health services, they have to put out a lot of money, and that shouldn't be so, because mental health is, in my opinion, and a lot of research is now showing it, what is an iceberg. So the iceberg, you see the physical illnesses, and what is below is a lot of mental health issues, so trauma and its consequences. And unless we start to improve our mental health services, then this is going to continue. So,
but how do we improve mental health services?
Well, encouraging young people to move into that field. So, for example, the young doctors. How many young doctors do we have in St. Lucia? Maybe over 100. How many of them are thinking of going into psychiatry? Maybe one or two. So how can we encourage more of them to move into that field, so that mental health is made a priority? Because it's not a priority. So everybody wants to go into gynecology and medicine, internal medicine and surgery and all these kind of fancy things. The results of all of which are because of mental health issues. I mean, a simple thing like high blood pressure. I have a patient of mine who is in a very stressful job. And he came to me because he was very anxious. And all I taught him was simple breathing exercises. Because every time he goes to the doctor, his blood pressure is sky high. And he started practicing them. And he started to feel more calm and more safe. And now when he goes to the doctor, he sits and he does the breathing exercise. And his blood pressure has gone down significantly. So imagine if we had the entire populace practicing stuff like that. Imagine if we had psychiatrists or psychologists in each health center or in clinics island-wide, where persons could go in to get some kind of solace from the stress that they experience, on a daily basis, where it would be confidential, because that's one of the difficulties persons face here with the public health system, the confidentiality. So persons want to know that when they go in to speak to somebody, that the issues are confidential, because lack of confidentiality also breeds lack of safety. Because I cannot feel safe if I am going to somebody and I'm not sure where my information will end up.
Do you think you have less people interested in things like psychiatry, again, because of the stigma that's associated?
Definitely. Stigma and fear. I guess stigma gives rise to fear. Because persons believe, they still have this long ago notion that once you go into psychiatry, you'll end up quote unquote mad. And I mean, that is a farce.
Or maybe the challenges of dealing with people who have mental health issues.
So not knowing that as part of the training, you do learn how to deal with it. And even those who know that, they're still afraid, because they know that they have some issue going on, and they believe that going into that field may push them over the edge. And
so how does having more psychiatrists help a country better cope with stress and so on?
It helps because it would make mental health care a lot cheaper, so more accessible. and persons would feel safer knowing that if I am going through a period of stress, I have somebody I could go speak to in a safe environment that's confidential, and that the person can equip me with certain tools that I can use on a daily basis to regulate my nervous system. Because that's what needs to be done. The nervous system needs to be regulated. And now I'm on the issue of regulation. We also have to look at something called co-regulation. Because that's one aspect that a lot of persons are not aware. I'm sure when you see a baby and the baby does you yourself feel a little joy inside of you, yes?
Yeah.
And that's called co-regulation. So the baby's nervous system regulates yours, and the parent needs to be able to do the same for a child. Yes? When somebody angry comes at you, what do you feel? Angry as well, right? Because you have to defend yourself. And that is co-regulation. And even one aspect of co-regulation we're not even aware of. If I start to yawn here, you start to yawn as well, you know. because that's what we call mirror neurons. So the mirror neurons pick up on what your nervous system is saying and feels like an urge to do the same. And that's why parenting with regulated nervous systems is important, because a child is experiencing distress, like the child being a child, playful and so on, breaks a glass, and the child is already afraid, and this thing made a big noise, and the child is feeling a lot of emotions, and then the parent comes at the child with lots of emotions. That does not help, because the child feels, I am already feeling unsafe by this breaking, and now my parent is now scary, making me even more afraid, and I'm feeling even more distressed. So what do I do?
And on that note, Dr. Gilead, please, I need your expert advice or opinion on this thing. A lot of children are petrified of being in the dark. Even if you're in the environment, you're not necessarily, say for example, they want to go to the restroom. You have to go with them because they're petrified of the dark.
Yes.
Why is that?
Yeah, I know even adults who are petrified of the dark, Andrea, and that is a phobia that some children have. What we have to ask is, where did that come from?
That fear of the dark.
Exactly.
Yes.
So it's possible that and I have a couple of them who, when I check into the history, what I find is that after birth something happened. So maybe the child had to be put in the nursery for a few hours. You understand? So that's how far back it goes. And the child felt afraid in the nursery. Well, we don't know how the child felt. But, but that's the history. The child was put in the nursery, or the mom herself went through something during pregnancy that had to do with that kind of environment. And so that fear was translated into the child. Yeah, so the nervous system always remembers. Always. And you see one of the things that causes us to walk around with so much stress is that in the Caribbean, for example, we've been taught to be strong, you know, to push out your chest and deal with it, get over it, you know, it's only in your head, this kind of things. And so instead of persons being approached with a gentle, caring voice or touch, we're very harsh on them to get over whatever it is that they're going through.
Exactly.
And that in itself cultivates them being hard on themselves. So the act of being hard on yourself is you stimulating the sympathetic nervous system, or you putting yourself through stress. Yeah?
What about things like not wanting to sleep with the lights off?
Not wanting to sleep with the light off.
In other words, you want the lights on.
Yeah, because
some
persons feel more soothed or safer with the lights on. So it has to do with safety.
The reason I'm asking this is because according to what the experts are saying, in order to get a good night's rest, you have to put off all the lights and this sort of thing. Keeping lights on will mess with your sleep.
But some persons feel safe with a light on, because the darkness causes the nervous system to be activated, because they see it as a threat. Yeah. Yes, Andrew. Any fear response has to do with is a trauma response, you could say, because it's the brain has learned that whatever stimulus it is dangerous, And so once there's a part of the brain called the amygdala. Once that is stimulated, then the whole system goes into overdrive in order to try to protect itself. And one of the ways to protect yourself is to look towards safety, so to try to get to safety. And with safety is where we thrive. So we cannot thrive if we always in survival mode. A lot of the persons you see who are always on overdrive, always doing, and cannot sit still and always have to be saying yes to this and doing that. And yes, they may build wealth and so on, but at the end of the day, their bodies start to break down. And that's why I think some persons say you work hard for 50 years or 40 years, and then at the end of the 40 years, you have to be taking care of your health now.
Yeah.
Right, and that's just because of that, because your body eventually breaks down. But if you learn to develop a sense of safety, learning how to regulate your nervous system, learning how to say no, for example, to things that you need to say no to, then you actually teach the nervous system that there can be moments of safety in between.
Okay, you have a call? And let me just take the opportunity to give the numbers. The fixed line is 572-9710, 572-9710, or you can WhatsApp 287-0971. WhatsApp is 287-0971. And this is Mind Matters with Dr. Julius Gillard. You have somebody on the line, Dr. Gillard?
Good morning, caller. Thanks for calling.
Good morning, Andre. Good morning, Dr. Gillard.
Morning to you, sir.
Okay. Dr. Gillard, thanks for accepting my call, brother.
You're welcome. It's a pleasure.
Yeah. Dr. Gillard, that disease, a seizure, and some call it fix. These are mental diseases?
Yeah, well, it's a neurological disease, and it happens in the mind. So, yes, it is a mental illness. It's not classified as a mental illness, but it's classified as a neurological illness.
So with this illness, I mean, what percentage, what volume of the brain this disease really occupy?
Well, it depends on the person. So somebody having, and persons don't realize there are multiple different kinds of seizures. So from generalized to localized seizures. And it depends on the person. It depends on where the lesion is in the brain.
The person age come into play there too?
Well, the person is not the one causing the seizures. The person's brain has an injury. And that injury usually causes scarring. So then what happens is that the brain cells get damaged, and so the brain signals have to find a way to get to where they're going. So in addition, the scarring can cause irritation, so irritation to the brain tissue, and that's what usually causes the seizures to happen. So the irritation causes the seizures, and the person may have shaking, like what they call fits, but seizures can also be a change in behavior that's sudden. Seizures can also be a whole host of things. The person may be able to may develop issues with their speech and so on, and it's a lot of stuff.
And this, is this really come with the person's age? Like, it depends on your age, like it will affect more of the brain depending on your age?
No, well, not the age, but the amount of injury that the person has in the brain.
So the person's age has nothing to do with the
amount of
the
seizures?
brain? Yeah. The amount of the brain, because the brain is is the organ that absorbs those things.
Okay, so I think there may be a little bit of confusion. So a seizure occurs from an injury.
I'll listen on the radio.
Yeah, okay. Thank you, sir.
Thank you.
Thanks for calling. So a seizure is due to an injury in the brain tissue. Yeah? That injury may be microscopic, or that injury may take up a big part of the brain. And the age has nothing to do with them, like he said, the how big or how much of a seizure focus, that's what we call them, how much of a seizure focus that there is. It depends on the injury that has happened. So infections to the brain can cause injury, and hitting your head can cause injury, a stroke can cause injury. And what is being found these days is something called micro strokes. So as we get older, and especially those of us who have things like high blood pressure, high cholesterol, and diabetes, we what may happen is that with the high blood pressure, small blood vessels in the brain may rupture, and those are not big ruptures. So it may have like a little dot, a little pinhead of a rupture in certain parts of the brain. And as time goes by, with more and more of those things happening, you may start to see things like seizures starting to happen. You may start seeing things like especially dementia happening, change in behavior. The person may lose their speech. A lot of things can happen depending on where all of those micro strokes do occur. Yeah. Now it's not just a rupture of a blood vessel. If the person has high cholesterol, for example, and it's not controlled, or diabetes, then what happens is that the little plaques, what we call them, I'm not sure how it's called in English, but plaques of atheroma along the blood vessels can be released, small little plaques that get lodged somewhere in the brain and causes the blood flow to that part of the brain to be compromised. And that's how a stroke is formed. But you may have micro of those happening in a certain part of the brain or different parts of the brain that can again lead to dementia or seizures or other issues with the brain. Yeah. So as we grow older, it's very important to note those things. So we have to control our blood pressure, we have to control our weight, we have to control our cholesterol, and we have to control our blood sugar. So diet is even more important as we get older.
Okay.
I hope that answers his question.
Yes. Let's just remind our listeners and viewers that this is Mind Matters with Dr. Julius Gilead, brought to you the compliments of Forsyth.
Mental health is the foundation of our well-being, yet too often it's overlooked. At Forsyth Mental Health Solutions, our team, led by a licensed psychiatrist, provides personalized assessments and treatments for depression, anxiety, psychosis, dementia, and more, bringing expertise, compassion, and solutions that make a real difference. We also provide forensic psychiatry assessments, mental capacity evaluations, and workplace training and seminars, giving organizations the tools to support employee mental wellness. For more information or to schedule a consultation, visit us at the Top-of-Your Hospital, New Wing, Castries. Call 459-2234, send a WhatsApp message to 584-9498, or email us at forsych.mhs@gmail.com. That's forepsych.mhs@gmail.com. Our professional staff will be more than willing to assist you. Visit Forsyth Mental Health Solution and let us build a future where mental health is prioritized. Because when minds thrive, so do people.
Welcome back to Mind Matters with Dr. Julius Gilead. Dr. Gilead, it's back to you.
Thank you, Andre.
Let me just remind our listeners of the numbers. If you'd like to call in and make a contribution, ask a question, add to what Dr. Gilead is saying, you can call fixed line 572-9710. Fixed line is 572-9710, or you can WhatsApp 287-0971. The WhatsApp platform, it is 287-0971. Yes, Dr. Gilead, you were saying?
Yes, so just to recap what we've been saying. So the body remembers everything that the mind does not or tries to forget. And that is important because the mind at times does try to forget. For example, somebody goes through a traumatic experience that the system really cannot deal with, and the mind does something called repression. So the mind shuts it down, so it's put into a box somewhere. That's what it's said to happen.
And that happens for what? To protect you or something?
Yes, it's a protective mechanism. Yeah. So other times persons suppress. Now suppression is different to repression. Repression is an automatic process. Suppression is a voluntary one. And with suppression, you can access the memory at any point. But with repression, it's very difficult to get to that memory. And a lot of persons would probably need to go through things like hypnosis to find that memory.
Wow. Please hold your thought. You have a call.
Okay. Go ahead, caller. Morning. Thanks for calling.
Good morning. Morning, Doc. Morning, Andre.
Good morning.
I just have a simple question. It may be simple to me. I don't know. I've been a very forgetful person when I was very young. Like in my 30s, I realized I was forgetful. But now I'm 55 and I forget so badly that if I just have a conversation with somebody and we hang up the phone, I actually forgot what we spoke about. I actually forgot what I said, what the person said to me. Like I find my memories getting really, really, really bad, and I just want to find out what can be the cause of that. And thank you.
Good question.
Yes.
Good question. Thank you.
Thank you, caller. And what I want to point persons to is that is one of the consequences of trauma. So forgetfulness is one of the ways that children especially cope with trauma. And they may be called stuff like lazy, or they may call dumb, or they may call all kinds of names, or they may be told, especially you doing it, you remembering what you want to remember,
Yes.
these kind of things. But the child is basically trying to cope with an environment where they feel unsafe. And I'm sure if I were to have an in-depth conversation with this young lady who just called, what we may find is a family system where as a child she felt unsafe. She felt either unheard, or she felt that her needs were not important, or she felt that she had to put everybody else's needs above hers. So she had to basically caretake everybody else in the family. And that is one of the things that happens a lot with trauma, that the persons who experience the lack of safety as children, they put the needs of the others above them, and they grow up to be people pleasers and so on. The thing with girls is that as they grow up, they have an interesting hormone called estrogen and even progesterone that helps, it acts as a buffer. Yeah, so it helps them create systems around the forgetfulness, and so they may see them having chats and ways of doing things, and they may become very rigid in the way they do things. So those persons become more or less perfectionistic. So things have to be done that way, otherwise it may end up as a disaster. The thing about it is, as they age, what happens is as they approach menopause especially, the estrogen levels start to fluctuate and drop. And so that protective mechanism is not there, and the forgetfulness returns, maybe even worsens, and the person may find themselves very distressed by what is happening, and maybe even believe that they're going through dementia, but it's just that the estrogen is no longer there. And I advise persons who are going through menopause, who experience stuff like that, to speak to your gynecologist, so see if maybe hormone replacement therapy may help. Because if it is due to the fluctuating estrogen, the hormone replacement therapy can play its part in helping to deal with that.
You have another call.
Yes, good morning, caller. Thanks for calling.
Good morning to my two favorite gentlemen.
Oh, wow.
Thank you.
Yes. So I would advise this young lady to see not only her gynecologist, but to see you. Because I remember I was going through that same thing. I kept forgetting. I thought I had early onset dementia. I was terrified. I was also going through menopause, which was surgically induced. And I could not remember anything. Conversations, meetings, what was I doing? And it took a toll on me and my confidence and the way I saw everything. And once I started to get the right therapy and do the right steps, things started firing differently. I started working recently and it started firing. The brain starts to work differently. So that is something I would advise her to do. Come in, have a conversation, because that is very, very, very important. And she sounded like she is terrified. And I would say to anybody who is going through that also, if you don't feel like you're comfortable yet going to see a psychiatrist or your gynecologist, maybe you can start thinking back on your childhood and analyze your life, analyze what you have experienced, how you react to things, when the memory loss started getting out of hand. And your life is basically a jigsaw puzzle. Try to get the solutions for yourself, which is what I did. And turns out my childhood trauma had so much to do with me as an individual, as a woman, as a partner, as a human, not a human being or human doing, just a human generally. So I would implore her to get some professional help. Thank you. Bye. Have a
Thank you.
Thank you for calling.
Take care. Bye-bye.
Maybe that caller should start a support group where she is. It might be very beneficial to the women where she is, because, I like the insight. What I like to stress to persons is to remember that psychiatric diagnosis or consultation should be one of the last things that you do, because persons like to rule out physical stuff before they go to mental stuff. And remembering that not all psychiatrists are the same, and not all human beings think the same. So ruling out seeing a gynecologist would be preferable, because I see it a lot in women, especially around perimenopause age, that they start to experience lots of distress, especially mental distress that they cannot explain. And so the hormone replacement therapy may help, and the gynecologist, if she realizes that it is really something more than that, then can refer the person to a psychiatrist, where they can be evaluated for other things like ADHD and so on, which again worsens in the perimenopausal age. So yes, Andre,
let me just get the numbers again.
Yes.
The fixed line is 572-9710, 572-9710, or WhatsApp 287-0971. WhatsApp is 287-0971. And we have Mind Matters with Dr. Julius Gilead. Dr. Gilead, some people may probably want to call about other matters related to...
That's fine.
Okay, fine. Yes. Okay. Just in case you want to bring up some other issue. Yeah.
So what I want to touch on is trauma in children. So children tend to express trauma differently to adults because they don't have words. And the way that they show it is in behavior.
Please hold your thought. You have another call?
Sure. Good morning, caller. Thanks for calling.
Good morning to you, Doc, and good morning to you, Andre.
Good morning.
I'll ask a short question. About 2 months ago, I fell and I knocked my head, and I had no recollection of the incident. Someone told me, I explained to somebody who I met on the way, and I told him what happened, and thereafter they told me, how you doing? And I said, what you talking about? And they said, you took a fall and told me all the details, and I have no recollection. It's been about 2 months. Would that be suppression from the pain, or I don't know what it is? Any idea?
Okay, so usually what happens is when some persons fall is that they experience a concussion. So what we call in psychiatry a traumatic brain injury. And what I know from medicine is that usually persons would need an immediate medical consult. So they would probably need to have a brain scan done at the time of the incident. And if that's not possible, then a brain scan at least within 2 to 3 months after the incident, to ensure that there's no scarring of the brain or no other brain injury that usually turns up around 3 months after the injury. So traumatic brain injury is something that always needs to be taken seriously, because it can cause stuff later on in life. So it can put you at risk for stuff later in life. And what I said, risk doesn't necessarily mean that something will happen. Okay. But seeking medical attention is important, because you will rule out any further brain injury or more severe brain injury, which can be treated by a neurosurgeon.
Fantastic. Thank you. Also, I did go to the doctor after the fall, but at the time I wasn't aware that I'd seen somebody. I had spoken to them about the fall, so I couldn't tell the doctor, hey, I fell and I had no recollection, so there was never follow-up regarding the loss of memory at that time.
Yeah, I mean, if you start to develop headache, or you start to develop double vision, or you start to develop a change in behavior or stuff like that, then you probably should see somebody urgently so they can do the necessary brain imaging to rule out brain injury.
Okay then. Thank you, Doc. Much appreciated.
You're welcome.
Thanks for calling.
Okay.
Alrighty. Bye-bye.
Yes, so I was speaking about trauma in children, and some of the signs of trauma in children is aggression. Well, that's the most common one. So aggression, withdrawal, school problems, even difficulty trusting adults. And a lot of parents, when they see their children misbehaving, they tend to become very angry at the child. And the trauma may be that in the first place that the parent was angry at the child, and the child, in trying to deal with the emotions that are coming up for them, become aggressive at school or in the other social situation.
Please hold your thought. We have another call.
Good morning, caller. Thanks for calling.
Hello, good morning.
Hello, good morning.
Hi.
Good morning.
Yes, go ahead, caller.
I just want to ask a question.
Sure.
Can being too upset cause a seizure? Because I'm asking because I have a 12-year-old cousin. She had a seizure. I think she was probably last year or 2 years ago, and she had a head scan done, but nothing was found. And her mother kept on saying that she was upset because she was not allowed to go to a particular place. Thank you.
Thank you for calling, caller.
Can being too upset cause a seizure?
Yes.
Thank you.
So what we have to do is know a few things. So a brain scan does not rule out the presence of a seizure disorder. Yeah. So a lot of things have to be done. So first, the person probably would have needed to see either a neurologist or a neurosurgeon or medical doctor, and the persons would need to see the seizure, because some persons have something called pseudo seizures, especially if they get very upset. So that's one of the ways of dissociating when the nervous system goes into hyperdrive. So they dissociate by mimicking some neurological symptom. In psychiatry, we call it a functional neurological disorder. So they have symptoms, and they may seem very realistic, of a neurological disorder when they're upset, and they may actually get a diagnosis of a neurological disorder, but it is due to the stress of the situation that they were in. Now again, back to seizures, which cannot be ruled out by a CT scan alone. So if the doctor is convinced that it was a seizure from the explanation of the parent, or they have witnessed it themselves, maybe in the emergency room, then that person may need to receive further investigations. So maybe an MRI, blood tests, and maybe may need to be referred to either an internist or a neurologist for further treatment. Or if it's a child, then a pediatrician. Now, what happens with some children especially who do have those seizure-like episodes when they're upset is that the parent then becomes more harsh with their treatment of the child, and that may just worsen the situation, because even those symptoms may suggest the presence of a mood disorder like depression or anxiety in the child, and they may come out as a functional neurological syndrome or symptoms. And again, it's a child not feeling safe. So the child doesn't feel safe, and the child expresses, or that's how the symptoms of lack of safety come out. I don't know. The parents, what I find is that parents tend to have closed minds to a lot of those things when it comes to their children. In their minds, a child just has to obey me, and there's no question about that. It's very disappointing to see, because you see the children really hurting, and they love their parents, and they crave for the attention and the feeling of safety from their parents, but they can't get it because the parent is so concerned about being respected or being taken for granted, or other persons seeing the child's behavior and calling them a bad parent, or they themselves may consider themselves to be a bad parent. So that atmosphere, that environment of safety, they themselves have difficulty creating it for the child because they have never felt it. And case in point, I have a parent who has a little boy who is now starting to act up in school. And that parent is a patient of mine. And that parent has never felt safe in her life. So now she has no clue on how to create safety for her son. And her son is now feeling unsafe. and acting out, and she doesn't know how to create safety, so it just causes a melting pot of more lack of safety and more acting out and more lack of safety, whereas somebody needs to step back, take a couple breaths, and ask, what am I doing here that is not working? And how can I do differently? Not how I can do better, but how can I do differently? Because this is not about doing better. It's about doing differently for your child, because you never got that. And some parents will use even that. I never got it, and I survived. You must survive.
Yes, I've heard that already. Mm-hmm.
Yeah, you have so many. I hear it so many times. Or my mother beat me, or my father beat me, and I survived. So you can survive.
Here's another one. My father was never there for me,
yes,
so you'll survive.
Yes. So is that fair to a child? And all of those phrases come from a place of pain. So those persons themselves are going through pain, and they are denying themselves the opportunity to deal with that pain because they just find it too much. They feel that if they go into it, that they may become overwhelmed and they may not survive mentally. I mean, I have persons who come to me and tell me they cannot go into it because they feel like they're going crazy.
Mm-hmm.
Yeah, so the fear is real for those persons. And again, points back to the lack of mental health services that we have here. They don't have access to that. So they don't know that this person and that person and this person went through a similar thing, and they were able to make it through. So they believe that they in isolation, that they working in isolation. And if I go to a psychiatrist or a psychologist and my friends find out, they'll call me soft, or people will take advantage of me, or people will do things to me or stuff like that, or I may get crazy and people will laugh at me, you know. And so they turn to a bar, or they turn to other issues, things that don't help in the short nor long term.
But I was just thinking, Dr. Gilead, don't you think that the first step is not really having more people dealing with mental health issues, but first trying to get rid of that stigma?
Yeah, well, the stigma can be controlled by having it more available. So by having mental health services more available, stigma will decrease, and that is something that has been proven. Yes, look at Jamaica, for example. Yes, there's still a lot of mental health stigma in Jamaica, but it is significantly reduced because they have a very vibrant mental health system in Jamaica. You can go to almost any health center in Jamaica, and they'll tell you that the psychiatrist, not just a mental health nurse, but a psychiatrist or the team, they tell you a team is coming that day or that day or that day. And so the person knows that on that day they have somebody available to them to treat them.
That is true, Dr. Gilead. As a matter of fact, I read stories from Jamaica quite regularly. Yeah. And anytime there's any sort of trauma, you hear all of us, these teams put together and to provide counseling and support services and so on. Yeah, you're right. You're right about that.
Even after Melissa, I see a list of things they need, and you don't see mental health services on that list. It's only physical items because they have their system ready to go in case of any disaster. They have the mental health psychosocial support system very well oiled, that in case of anything comes up, they're ready to go.
I was just thinking about the 5-year-old boy that died in an accident in the south of St. Lucia, and I just asked myself, I wonder if there was a follow-up in terms of providing sort of mental health support and so on to that family.
Well, I cannot answer that question.
That's just one little example.
I can't answer that question. And even I saw somebody yesterday whose family member died by suicide a few years back, and I asked, did any of you receive mental health treatment? I think that person was about 13 at the time. And no, the answer was no. So entire family, they were very close, and one of their family members died by suicide, and nobody received any kind of mental health care after that. And then things started to happen with the family after that. And that's it. We have no kind of services available to persons who go through those kinds of traumatic situations. So it's like the person who died by suicide is the only person that was going through something or will go through anything, and the rest of the family, what's happening with them. So yeah. So Andre, one of the things to keep in mind is that healing is possible at any age. Now, persons believe that healing is only through therapy and going to talk to somebody and so on. But healing from trauma is not just through talk therapy. The person themselves have to learn how to treat themselves in between the therapy sessions. So by learning to connect with their bodies, for example. If I were to ask you, for example, what are you experiencing in your body right now? What would you tell me?
We have a call before I tell you.
After that. Yes. You see how quickly he likes to run? Mind Matters, good morning. Thanks for calling.
Good morning, Dr. Andre.
Good morning.
I want to ask a question. Well, the question you asked, Andre, healing is at any time. For me, it was after 30 years. One of the questions I want to ask, I have no memory of anything that happened to me before 7. I was also told that I can get, you said it earlier, oh my God. Anyway.
Hypnotherapy?
Yes, and I asked, why would I want, and I sure it's some form of trauma, why would I want to even remember if it's something so bad? The question is, does it really matter? Like, I don't think I need to know, but do you think it's a good thing to know?
Okay, thanks for calling, caller.
Thank you.
So one of the things to note is that not remembering anything before a certain age in childhood suggests two things. So it suggests either nothing happened, or it suggests that too much happened, and so the brain had to repress those memories. Like I said earlier on, the brain can do that, but the body doesn't have that luxury. So if you are experiencing something visceral and physical in certain situations, it's likely that something did happen. Yeah? So knowing may not help because the brain does it for a reason. The brain knows why it represses a memory. And those persons who really want to know what the memory was, they have to be prepared for the consequences of that knowing. So if you don't want to know, then that is fine. I don't think anybody should push you into knowing, because you then are the one who has to deal with that afterwards. So let's say, for example, somebody whose father sexually abused them when they were like 3 or 4, and they have no memory of their childhood. And then you get that person to find out that memory, what happens afterwards. Yeah? Incest is one of the more difficult things to deal with. So
I would imagine.
Exactly. Because the child has so much shame to deal with after that. Or the person has so much shame to deal with after that. So much pain and disappointment and anger to deal with after that. So not knowing, if the person doesn't want to know, then that's their prerogative. But if they really, really want to know, yes, then they have to know that there are consequences of knowing, because the brain knows what it's doing. The brain doesn't recall, it doesn't recall, but your nervous system remembers. Yeah?
Yeah. You have let's take a final call.
Sure. Good morning, caller. Thanks for calling.
Yeah, good morning. Yeah. I heard you talk about that they didn't have that support system, when something happened. But yeah, isn't it possible that as doctors that y'all could get together and have a recommendation done, that y'all could have something in place that when stuff like that happened, like Andre mentioned, like the kid died and nobody reached out to the family and that kind of thing, is it possible that the doctors get together and put something in place? Because sometimes you always wait for the government to do something, but if we recommend something to the government, I'm pretty sure that that's something that they could work with. They would accept it. They cannot come together and do everything, but some stuff that needs to be done by different organizations.
Yeah, so
thank you, caller. Thank you very much.
So you see, what a lot of persons don't realize is that it's not the government doing things. So there's a Ministry of Health that is responsible for things like that, and they take guidance from their mental health representative in the ministry. So from what I know, they do have a mental health lead person in the ministry at this moment, because the government is making ways or making paths towards what I'm speaking about. But this is a long process. So doctors just making suggestions to the government may not go anywhere, because from what I remember, the doctors have made suggestions in the past. And usually these things come out as policy, and making suggestions to the government is not as easy as it seems, or telling the government what to do or what should be done or what shouldn't be done. It's not as easy as it appears, and it's a process. But the ministry, from what I know, is starting to put things in place very slowly, but very surely. I know that there's a mental health policy committee now meeting to try to put forward a mental health policy or mental health plan for St. Lucia, as well as revise the Mental Health Act and all of those things. So things are being done, and we have to now be patient with what's happening and hope that it does reap the benefits that we want. I always tell persons, my job is not to change the mental health system in St. Lucia. I just keep noise, because I know it may not be done in my lifetime. It may not even be done in my child's lifetime. It may come long after that, because this issue with stigma and funding for mental health is a worldwide problem that has been there for millennia. So we have to be very patient with what's being done. So I see Andre has run away from my question, but that's fine.
But we have to end. We have to end. Dr. Gilead.
Thank you very much for having me, and thanks for having me today, callers. What I want you to take from this episode is that trauma is not weakness. Trauma is injury, and like injury, it can heal. So when we understand ourselves, we stop judging ourselves, and we make space for real recovery, then we get on that path to healing. So join me next week on Mind Matters. I'm Dr. Julius Gilead, reminding you that your body does keep the score of your trauma, but your body can also heal.
And Dr. Gilead, I want to say again, bravo to you. I say so privately. I need to say it publicly, for stepping out and introducing this program on Rev-Up, where you're dealing with mental health issues.
It's a pleasure, Andrew.
Yes. Thank you very much, and looking forward to seeing you next week, Wednesday.
Same here.
Alrighty. You've been listening to and viewing Mind Matters with Dr. Julius Gilead. Listen again and view again next week, Wednesday, same time from 10 o'clock until 11, only on Rev-Up St. Lucia, and brought to you the compliments of Forsyth.
Mental health is the foundation of our well-being, yet too often it's overlooked. At Forsyth Mental Health Solutions, our team, led by a licensed psychiatrist, provides personalized assessments and treatments for depression, anxiety, psychosis, dementia, and more, bringing expertise, compassion, and solutions that make a real difference. We also provide forensic psychiatry assessments, mental capacity evaluations, and workplace training and seminars, giving organizations the tools to support employee mental wellness. For more information or to schedule a consultation, visit us at the Top-of-Your Hospital, New Wing, Castries. Call 459-2234, send a WhatsApp message to 584-9498, or email us at forsych.mhs@gmail.com. That's forepsych.mhs@gmail.com. Our professional staff will be more than willing to assist you. Visit Forsyth Mental Health Solution and let us build a future where mental health is prioritized. Because when minds thrive, so do people.
Have you noticed behavioral changes in self and loved ones that trouble you? You lose